All right, ready to dive in. Today we're tackling anti-infective agents, using your study guide, of
Yeah,
course,
lots to unpack there.
for sure. Whether you're studying for exams or just, fascinated by these medications, this deep dive is going to be a wild ride. Bacteria, viruses, fungi.
The whole microscopic world. And trust me, there's a lot more to these medications than you might think.
I bet. So our study guide lays out the battlefield, antibiotics for bacteria, antifungals, antivirals, and then we have these,
Immunostimulants and immunosuppressants.
yeah. Can you kind of set the scene for us? What are we dealing with here?
Well, you can think of it like a microscopic war zone going on right inside your body. And these anti-infective agents, there are specialized warriors, each designed for a specific enemy.
Okay, I'm picturing it.
So antibiotics, right? Think of those as like demolition experts. They target the walls of bacteria, make them crumble.
So it's not just a random attack, it's targeted.
Exactly, but some bacteria are pretty clever. They figure out ways to resist those attacks. And that's where understanding like the specific mechanisms of action of each class of antibiotics becomes really important.
That makes sense.
Like aminoglycosides, for example.
Mm-hmm.
Those are often used for some serious infections. They work by getting inside those bacterial cells and messing up their protein production.
Oh, so they can't make the stuff they need to survive.
Right, but here's the thing. They can also be toxic to the kidneys. So nurses need to keep a close eye on things like, BUN and creatinine levels, those kidney function tests, especially when giving these medications.
Oh, wow. Yeah, that's a great point. It really highlights how important it is for nurses to understand not just how the drug works, but also how it might affect the whole body.
Absolutely, the whole picture. Now let's switch gears. Let's move from bacteria to fungi.
Okay, a whole different world.
You got it. Can't just throw antibiotics at every infection, right? Fungi are different. They've got their own weaknesses we need to exploit.
Gotcha. So how do we attack those?
Antifungals, right. They've got their own unique ways of working. Some of them, like the azoles, they mess with the formation of ergosterol. It's this key thing in fungal cell membranes. Makes them vulnerable.
I see, weakens their defenses. And this is where a medication like fluconazole comes in. The flucan.
Bingo. Fluconazole, yeah. It's a really commonly prescribed azole, often used for yeast infections.
Makes sense.
But gotta remember, fluconazole, it can interact with other medications, and it can potentially cause liver damage.
Oh.
So nurses have a big role here in educating patients about those possible side effects and, watching those liver function tests.
Wow. So even though it's targeting the fungal infection, we got to watch out for the effects on other parts of the body.
Exactly, exactly. Holistic view, right? Always considering the patient's overall health.
For sure. Okay, now what about viruses? Those seem even trickier, right?
They are, because they actually hijack our own cells to replicate. Sneaky little things.
So how do antivirals even work then? If the virus is using our own cells as a shield.
Well, they have to be sneaky too. Some antivirals, like a cyclover,
Mm-hmm.
that's used for herpes infections. It interferes with how the virus replicates its DNA.
So it's like jamming up their copying process.
Yeah, exactly. Now, another important one to talk about is metronidazole, Flagyl. It's kind of unique.
How so?
It's effective against both, like anaerobic bacteria and certain parasites.
Oh, wow. So it multitasks.
It does, but gotta be super cautious with this one.
I bet there's a catch.
Big time. Metronidazole is known for this nasty reaction if you mix it with alcohol.
Oh, no.
It's called the disulfiram reaction. And it can be dangerous, really dangerous.
Yeah, alcohol seems to always complicate things.
For sure. So patient education about this interaction, it's absolutely crucial.
Mm.
Now, moving beyond these individual warriors, let's talk about something even more interesting. What if we could manipulate the immune system itself?
Okay, yeah. This is where those immunostimulants and immunosuppressants come in, right? I'm fuzzy on those.
It's like fine-tuning our body's defenses. So immunostimulants, those basically boost the immune response. Give it a little extra oomph.
Okay, so they ramp up the immune system's alarm bells.
Exactly. And they can be used for all sorts of things, certain cancers, chronic viral infections. A good example is interferon.
Okay.
It's used to treat hepatitis C, works by interfering with viral replication, and basically tells the immune system, hey, attack those infected cells.
Interesting. And then on the flip side, we have immunosuppressants. Why would we ever want to suppress the immune system? That sounds kind of risky.
It can be, yeah. Definitely increases the risk of infections, so it's not a decision that's made lightly, but sometimes it's really necessary.
Okay, when would that be?
Well, imagine someone gets an organ transplant, right?
Right.
Their body is going to see that new organ as a foreign invader. and it's going to try to attack it.
Oh, that makes sense.
So immunosuppressants, they help prevent that rejection. They calm down the immune system, let the new organs settle in. And they're also really important in treating autoimmune diseases, when the immune system attacks the body's own tissues.
So it's like telling the immune system, chill out, everything's cool here.
Yeah, exactly. But again, it's a delicate balance. You're weighing the benefits of suppressing the immune response with, that increased risk of infection.
Right, right. Lots to consider. So before we jump into HIV and AIDS, let's talk about how doctors actually figure out what's causing the infection in the first place.
Good point, yeah.
Like, is it a bacteria, a virus, a fungus?
Right, right. It all starts with a good patient assessment, right? Taking a look at symptoms, medical history, and any potential exposure to, infectious agents.
So like detective work.
Exactly. And a key tool is the culture and sensitivity testing.
Okay.
That basically means taking a sample from where the infection is. Could be blood, urine, a swab from a wound, and then they grow it in a lab, see what pops up.
Makes sense. So then how do they know which medication will actually work against that specific bug?
That's where the sensitivity part comes in. They test that isolated pathogen against different anti-infective agents, see which ones are most effective.
Oh, that's cool. Like a microscopic battle royale.
Exactly. Find the right weapon for the right enemy.
I like it. This is all super helpful. Now, I'm really curious about the HIV/AIDS section in our study guide. It's a tough virus, so I'm eager to dive into the treatment and management of that.
For sure, a fascinating but serious topic.
Okay, so let's start with the basics. How does this virus actually work?
Well, HIV, the human immunodeficiency virus, right? It's a retrovirus, meaning it carries its genetic information in the form of RNA instead of DNA. And its main target, the CD4 T cell.
Okay.
It's a type of white blood cell that's really important for the immune system.
So it's attacking the very cells that are supposed to be protecting us. That's messed up.
It is. And once HIV gets inside that CD4 T cell, it uses this enzyme, reverse transcriptase, basically converts its RNA into DNA. And then that DNA gets integrated into the host cell's DNA.
Wow. So it's taking over our own cells.
Yep. Like a hostile takeover. And as HIV replicates, it destroys those CD4 T cells. And as those cells decline, the immune system weakens, making the person more vulnerable to infections, cancers, things that wouldn't normally be a problem for a healthy immune system.
That's scary. So how does it spread?
Primarily through contact with infected bodily fluids. So blood, semen, vaginal fluids, breast milk. Most common ways are unprotected sex, sharing needles, and mother-to-child transmission during pregnancy, childbirth, or breastfeeding.
Okay, yeah. So understanding how it spreads is super important for prevention.
Absolutely.
Now, for someone who's already been infected, what happens next?
Well, it can be different for everyone, but generally there's this initial acute phase, happens pretty soon after infection. And then there's a longer period where things are kind of quiet clinically. And then eventually, if it's not treated, it progresses to AIDS, acquired immunodeficiency syndrome.
Can you walk us through those stages a bit more?
Sure. So that acute phase, it usually happens within 2 to 4 weeks after exposure. And the person might have flu-like symptoms, fever, fatigue, muscle aches, swollen lymph nodes, rash. But a lot of people don't even notice any symptoms at this stage.
So you could have it and not even know it. Wow. That's a big challenge for, stopping the spread.
You're right. That's why early testing is so important. So then after that acute phase calms down, the virus enters this quiet period. It's still replicating, but at a much slower rate. And this phase can last for years, even decades. And during this time, the person might feel totally fine, no symptoms.
But it's still doing damage silently.
Exactly. It's damaging the immune system, lowering that CD4 T cell count. And as those cells decrease, the immune system weakens, making them more vulnerable to those opportunistic infections.
Okay, I see. So how do doctors actually track how the infection is progressing?
They regularly monitor those CD4 T cell counts and viral load.
Viral load.
Yeah, it's the amount of HIV in the blood. Higher viral load generally means the virus is replicating more actively, greater risk of the disease progressing.
So the goal is to keep that viral load as low as possible, right?
Exactly. That's where antiretroviral therapy comes in, or ART.
Okay, let's dive into ART in part 2 of our deep dive.
Sounds good. We've covered a lot already.
Listeners, we'll be back soon to unpack ART, the treatment that has really changed the outlook for people living with HIV. Stick around. Welcome back. So last time we were talking about HIV/AIDS and how it attacks the immune system, and we're about to dive into ART, antiretroviral therapy.
Yeah, ART's been a real game changer. I mean, before ART, an HIV diagnosis that was pretty much death sentence. Now people with HIV, they can live long, healthy lives.
That's amazing. Okay, so bring it down for us. What is ART, and how does it actually work against HIV?
Okay, so RT, it's not just one drug, it's a combination, a bunch of medications that work together, and they basically suppress HIV replication.
Okay, so it's like hitting the virus from all sides.
Exactly. You got it. Multi-pronged attack, targeting different parts of that virus's life cycle.
I see. So there are different types of these antiretroviral meds.
Yep. Each with its own way of working. Like some of them are called reverse transcriptase inhibitors. They block that enzyme that HIV uses, to convert its RNA into DNA. So it can't integrate into the host cell's DNA.
So it's like stopping the virus from hijacking our cells right at the start.
Exactly. And then there are others, like protease inhibitors. Those mess with the assembly of new viral particles, stop them from maturing, basically, so they can't infect other cells.
Wow, so it's like outsmarting the virus at every step.
Yeah, I like
That's
that. Like a game of chess. And the cool thing about RD, the combination therapy, is that it makes it way harder for the virus to develop resistance.
Resistance. Oh, right. We talked about that with antibiotics. Is that a concern with HIV too?
Big time. HIV is a tricky one. It's always mutating, trying to escape our defenses. So that's why we hit it with multiple drugs at the same time.
Makes sense. So what's a typical RT regimen look like?
It really depends on the individual, but most of the time it involves taking a few pills once or twice a day.
And are these medications like a cure for HIV?
That's the thing. Not yet. We're not there yet. ART, it can suppress the virus to undetectable levels, so low that the tests can't even pick it up. But it doesn't completely wipe it out. If someone stops taking RT, the virus can come back, start replicating again.
So it's like constantly keeping it under control.
Yeah, it's a lifelong commitment, which can be tough.
I bet. What are some of the challenges for people living with HIV when it comes to ART?
Well, like you said, it's a lifelong thing. Taking those meds every day, consistently, that's not easy for everyone.
Yeah, I can imagine.
And then there are the side effects. Some are mild, nausea, but others can be more serious, like liver or kidney problems. And let's not forget about the stigma. A lot of people living with HIV, they face discrimination. They're afraid to tell people. And that can make it hard to get the care and support they need.
That's a really important point. So nurses have a huge role, not just in managing the medications, but also the emotional side of things.
Absolutely. Building trust with patients.
Yeah.
Helping them understand their treatment, and feel empowered to take charge of their health. That's so important.
Totally. Okay, so our study guide also mentions lab values, things that nurses need to keep an eye on.
Right.
Can you walk us through some of those?
Sure. So one of the most important ones is the CD4 T cell count. That tells us how strong the immune system is. As HIV progresses, that count goes down, and the person becomes more susceptible to those opportunistic infections.
So we're watching for any sign of those infections popping up.
Exactly. Educating patients about how to prevent them too, good hygiene.
Yeah.
Avoiding contact with sick people. And then the other one, the viral load. We got to monitor that closely too. Remember, the goal is to suppress the virus, right? So if the viral load starts climbing, we got to figure out why. Maybe the medications aren't working as well, or the person's not taking them like they should.
So it's constant back and forth. Monitoring, adjusting, communicating.
It is. And it's a team effort, right? Doctors, nurses, pharmacists, and most importantly, the patient.
Makes sense. Okay, we've covered a lot on HIV treatment, but we're not done yet. Remember those immunostimulants and immunosuppressants?
Oh, yeah.
I'm still really curious about them.
They're fascinating, those meds. They can be used for all sorts of conditions, not just HIV. Want to explore those?
Absolutely. Let's delve into that world in part 3 of our deep dive. All right, welcome back. So we've covered bacteria, we've talked about viruses, even dove into HIV treatment. And now we're getting into immune system manipulation.
Immunostimulants and
Immunosuppressants. It's like something out of a sci-fi movie.
it is pretty wild when you think about it, right? We can boost those defenses or we can, dampen them down depending on what we need.
Yeah, it's a lot of power. Okay, so let's start with the boosting side. When would we want to, stimulate the immune system? Isn't a strong immune response a good thing?
You're right. A healthy immune system is key. But sometimes it needs a little extra help, and that's where immunostimulants come in.
Okay.
They can be really helpful in treating certain cancers, some chronic viral infections, even those, what are they called, primary immunodeficiency disorders, where the immune system isn't working quite right.
Right. Right, so it's like giving those defenses a boost, like a shot of espresso.
Exactly. They work in a few ways, but one is by increasing the production of certain immune cells, like T cells and natural killer cells. Those are like the special forces trained to seek and destroy.
Makes sense. Okay, and then we have immunosuppressants, so those do the opposite. When would we ever want to suppress the immune response? Doesn't that leave us vulnerable?
It does, yeah. Definitely increases the risk of infections, so it's not something we do lightly. But there are times when it's absolutely necessary, like with organ transplantation.
Oh, right. To stop the body from rejecting the new organ.
Exactly. Immunosuppressants help to, like, calm things down, prevent that rejection, let the new organ integrate peacefully. And they're also really important for treating autoimmune diseases, when the immune system is attacking the body itself.
Right. So it's like telling the immune system to stand down.
Yeah, pretty much. It's all about finding that balance, right? Suppressing the immune response enough to help, but not so much that it causes problems.
Wow, that is a delicate balance.
Yeah,
So I'm guessing nurses have a big role here in terms of monitoring and patient education.
absolutely. They're watching for any signs of infection, making sure patients are taking their meds correctly, teaching them about the risks and benefits. It's a real team effort.
And speaking of teamwork, this whole deep dive has been amazing. We've covered so much. Antibiotics, antifungals, antivirals, even vaccines and sera. Plus those immunostimulants and immunosuppressants we just talked about. It's a lot to take in, but I feel like I have a much better grasp on all of it now.
It's a complex world, that's for sure, but it's also incredibly fascinating, right? The things we can do with these medications, it's pretty remarkable.
It really is. And it just highlights how important nurses are in all of this. Administering the meds, monitoring for side effects, educating patients, and just generally being there for them.
Couldn't agree more. Nurses are the backbone of healthcare for sure.
Absolutely. Well, before we wrap up, I have one last question. We've talked about all this progress we've made, but what about the future? What challenges do we still face when it comes to fighting infectious diseases?
That's a great question. And honestly, one of the biggest ones is resistance. We're seeing more and more bacteria, viruses, even fungi that are resistant to the drugs we have.
So it's like a constant battle. We develop a new drug, and then they evolve to fight it.
It is, yeah. It's an arms race for sure. And it's going to take a global effort to tackle it, using antibiotics responsibly, investing in research to develop new drugs, and just doing everything we can to prevent the spread of those resistant organisms.
Wow, that's a lot to think about. This deep dive has been an incredible journey. I feel so much more knowledgeable and honestly a little bit in awe of all the amazing work being done in this field.
It's pretty inspiring, right, to think about all the people working tirelessly to understand these microbes, develop new treatments, and protect public health. It's amazing.
It really is. Any final words of wisdom for our listeners as they continue their journey in this field?
Just keep learning, keep asking questions, and stay curious. This field is constantly changing, new discoveries all the time. And remember, there's a whole community out there supporting you, researchers, educators, other healthcare professionals. You're not alone in this.
That's a great message to end on. Thank you so much for joining us on this deep dive into the world of anti-infective agents. And to our listeners, keep learning, keep exploring, and stay healthy.